This week we will be performing 4 different flexibility assessments. The first one is going to be a Canadian trunk forward flexion test. The second will be a YMCA sit and reach test. The third will be a chair sit and reach test. And finally we will finish off with the Thomas test. Prior to performing the assessments, you want to make sure you remove your shoes, and you want to make sure you warm up with a moderate aerobic activity exercise for about 5 minutes. On how to perform the Canadian trunk forward flexion test, you will sit without shoes and the soles of the feet will be flat against a flexometer, or what is known as a sit and reach box, at the 26 centimeter mark. The inner edges of the soles are placed within 2 centimeters of the measuring scale. The key thing to remember about this assessment is that it's assessing hamstring and lower back flexibility. You should remove your shoes and you should sit with your feet flat against the box. As you're reaching forward, you should exhale as you reach. You should hold the stretch for 2 seconds and you should not lead with one hand. You should also ensure that your knees are not bent. For the YMCA sit and reach test, a yardstick is placed on the floor and tape is placed across it at a right angle to the 15-inch mark. You should sit with the yardstick between your legs with the legs extended at right angles to the tape line on the floor at about 10 inches away. Heels of the feet should touch the edge of the tape line and be, like I said priorly, 10 to 12 inches apart. You should then slowly reach forward with both hands as far as possible, holding this position for approximately 2 seconds. The next assessment will be the Thomas test. The Thomas test is used to measure hip flexor flexibility. You should lie supine and you should bring your leg to your chest. If the straight leg remains in contact with the mat, the hip flexors of that leg would be considered flexible. This test is scored as flexible or inflexible, and you need a second person to assist, and you must repeat the process on your opposite leg. Our last test will be the chair sit and reach test. These tests are used for many older individuals who have a difficulty performing sit and reach tests because their functional limitations prevent them from getting down to and up from the floor. Your height should be 17 inches and placed against the wall. There is no need to remove shoes in this case. You should extend one leg with the ankle dorsiflex, and you should keep the untested leg flat on the floor. You should keep your head in normal alignment and exhale while reaching forward. You should hold for 2 seconds and you will need a second person to hold the ruler and assist. The scoring will be in inches. The space between the big toe and fingertips as a negative score. If fingers go past big toe, it will be counted as a positive score. Touching toes is scored at a 0. The following table is the fitness categories for the trunk forward flexion using a sit and reach box by age and sex. In my case, my values were 36 centimeters, so I would be categorized under the good category. The next table is the fitness categories for the YMCA sit and reach test. In this case, my values were 21 inches, so that would categorize me at above average categories. In regards to the Thomas test, my results were flexible on both the right and the left leg. In regards to the chair sit and reach test, I got a positive 6 for both my left leg and my right leg. Some key things to remember for the assessments are that the knee should maintain straight and not bent. You should exhale when you're reaching